Good afternoon. Welcome to From Belly to Baby. Thanks for tuning in. We're a couple of minutes late. We were just getting the debrief from Dr. Allison Cahill, Chief of Maternal Fetal Medicine at Washington University and Barnes Jewish Hospital. Thank you so much for joining us today. We appreciate it.
Thanks for having me.
We are talking about a subject that people have a tremendous amount of interest in. My name is Abby. I am 25 weeks pregnant. I keep trying to say 26, but I'm not quite there yet. I just crossed the 25 mark. So I'm at the point where I try and fudge it into the next month or the next week. But if you are watching, we know a lot of people have been watching us throughout their pregnancies. We would love to know where you all are in your timelines. Put it in the comments how many weeks along you are, and let us know who's watching. So with that, we are talking about Zika virus today, and I know it is no one's favorite subject, but it's one a lot of people are interested in. So I think the first question that everybody has is, Dr. Cahill, can you explain to us what is Zika virus?
Sure. So, I think that what we're still learning a lot about Zika. Zika, as you said, is a virus that many of us haven't really thought about or heard about, and wasn't really part of something that we necessarily paid attention to in obstetrics. And then over the past couple of years, there have been reports and then larger series that, in fact, we think that this virus, if it infects a woman while she's pregnant, can actually impact the development of her baby. And so this is really something that scientists are getting after as to why that might be and how it actually impacts the developing baby. But something that we are thinking a lot about and getting a lot of questions clinically.
Okay, and as I ask questions, we encourage everybody out there, please dial in with your own questions. And by dial in, I mean type them in the comments section. And as we are able, we will certainly have those answered for you live here. But as we anticipate other questions coming in, can you tell us a little bit about how, I think everybody's scared of mosquito bites. So obviously mosquito transmission is one way that Zika is transferred to individuals. Can you talk a little bit about the different ways it's transmitted?
Yeah, so that's, we think, the most prevalent way, so the most common way someone would come in contact with the virus. We've also come to understand that it could be sexually transmitted as well. These things are something that we're kind of keeping in mind and trying to be careful about as we counsel patients who are anticipating becoming pregnant and those who are pregnant and considering travel and so forth.
It is so interesting because whenever I had seen my OBGYN for a standard appointment, I guess it was last year, and it was the question of, do you think you might get pregnant in the next year? And, of course it was a possibility, and immediately the conversation changed, and there was that, at least the cautioning, and it wasn't anything terrifying, but it was a reminder that there are guidelines out there suggesting that women do not travel to areas of this country and primarily into areas of other countries that could be infected. Where exactly is the virus right now?
You mean in what areas?
In what areas, yeah.
Yeah, so I think that this is a little bit of a moving target, if you will, and I think that as folks are trying to gather information for themselves and be aware of the areas that we're concerned about, probably the best place to go is the CDC website. And you can go on the CDC website, and there is a map, especially a map of the United States, and it's colorful,
yes.
And so it can give you some idea of areas that we're more or less concerned about. The large reports really came out of South America with regard to information that we were learning about Zika and then the potential consequences of infection during pregnancy. There haven't been any cases in the United States that have been gotten here. There have been cases where we're concerned or it affected folks who have traveled in and out. But we hope that we continue to have good prevention strategies.
And I know there was some worry last year, and I only know this because it affected what travel plans I had.
Right.
There was some concern that it was good at getting into the Miami area, and so I recently declined a trip to Orlando because it's the same state, and to me it feels like the same thing, but they're very different. And you say it's not being necessarily transmitted in the U.S. at this point. Right. We're not seeing signs of it yet.
Right. So, and really, what we're, when the CDC is looking at particular areas, there's really concern about whether or not the mosquitoes in a said area can carry the virus. It is important, as you mentioned, in thinking about planning a pregnancy to definitely discuss that with your provider, because of the sexually transmitted possibility and nature of things. It's not just where a woman is traveling, but where her partner might be traveling, and for how long. So there are some additional considerations. It's not something we want people to panic about or worry about, but become educated about and just talk to their provider.
And that's really good advice. I do recall it was last summer, I believe, a friend of mine, her husband is a physician, and he was traveling to South America on a mission trip. And at the time, I don't recall if she was newly pregnant at the time or if they were talking about that being a possibility in the near future. But he wound up going through some measure of testing when he came back. So are there tests that are readily available, or where does that stand in terms of when someone comes back from a foreign country determining whether or not they contracted the virus? Will you know? Or is it something that you have to go look for?
Yeah, it's a great question. So there are screening criteria that we in our offices do with patients and their spouses to see if we even think folks are at risk for having contracted the virus or been exposed to the virus. And then there are additional blood tests that can be done beyond that. Those are actually done through the Department of Health. Mm-hmm. So actually, my group here at WashU is one of the places where most folks are referred in for us to do that initial screening and be able to educate folks and tell them we don't think that they're at risk, or if they are at risk, to have some of that testing done. It's not at the stage where we're adding it to routine blood work. Mm-hmm. So we don't kind of test everybody, if you will. But again, it's something that we can test for if we think someone's either travel history or particular other kind of exposure history raise questions as to whether or not we think, a patient should be tested.
All right. And we have a question.
So Ashley says that she was diagnosed, in quotes, with Zika last May when she came back from Jamaica. Although the CDC in Chicago denied her testing, she had 4 out of the 6 symptoms. They're currently trying to get pregnant. Since she had symptoms already, what's her likelihood of contracting it again?
Oh, this is a great question. So it sounds like whether or not if she's already had the virus, can she contract the virus again, or does she have lifetime immunity? Yeah. I mean, I think that actually we don't know the answer to that question yet. The way that we know the answer to once you've had chickenpox, you're mm-hmm. unlikely to get chickenpox again. So again, so many of really good questions that we would think about clinically are really things that we don't know the answers to. And Zika is not brand new, but we think that certain strains that we're following now and might affect pregnant patients are newer. So the questions about whether or not you could get reinfected is something that unfortunately we're going to learn over time.
And what are some of those symptoms?
Well, they're very vague.
Yeah.
So including other than sort of being having knowledge that you've been bitten by a mosquito in an endemic area where you've actually been, the rest of the symptoms, fevers and mm-hmm. muscle aches and things like that, we could probably think of just about every virus we've ever had in our life makes us feel like that.
Yeah, it's so interesting because it doesn't sound like people who are infected with it, it's not like you're showing up on the steps of an emergency department in desperate need of immediate medical care.
That's
which
right.
is kind of makes it a harder mystery to solve.
That's right. And it's possible, as you just heard from Ashley, to have some of the symptoms but not other of the symptoms, just like all of us know in our life. No one exactly followed the book. And it's possible to be, not really have mild enough symptoms that you don't even feel symptomatic from it. So that's part of the reason about being knowledgeable about where we think there's concern about mosquitoes carrying the virus and what sorts of choices you might make around the time of conceiving and being pregnant, just to make the best choices for you and your family.
And is there a time frame that you recommend if someone has been exposed or in an affected area? Is there a recommended amount of time you wait before becoming pregnant, or is that still another unknown right now?
Yeah, it's a little bit of a moving target. So we're learning more and more. We actually think that the longer waiting time probably is when male partners have that travel and that exposure, because we think that there might be a higher dormancy for the virus to be in semen. So we actually, and that's influencing you can imagine our reproductive endocrine colleagues who are advising couples who are undergoing assisted fertility and having these sorts of considerations about whether or not they might have the male partner bank sperm before he travels and things like that. So there are a bunch of things that progress that we've made to be able to put some of those considerations into a clinical care plan. So it's really worthwhile just thinking a little bit about this, having some awareness about it, and talking to your provider to make a good plan.
And to put all of this in context, just to give people an indication of where we are in St. Louis on the campus of the Washington University Medical Center. So that's Barnes Jewish Hospital, St. Louis Children's Hospital. You take care of some of the most high-risk pregnancies
We do.
around. With all of that being stated, have you seen a case of Zika virus in your practice?
We have not. We have not. We have had the experience of having patients who, as we mentioned, have either travel history or other sorts of things where we think that they rise to the level that we would recommend some some testing. And so we have had some of that happen in our practice, but we have not seen any cases, thankfully.
So it's very rare.
Yes.
In the U.S.
Yes.
And has it been prolific other places? I mean, is this a new virus, or has it been around other places for an extensive period of time?
It's not new. I think that our knowledge about what we think current strains are and how these strains of the virus might impact the developing baby, though that's newer knowledge, and certainly newer public knowledge. As we've seen outbreaks or sort of high levels of the virus, and then the virus being transmitted. And as I mentioned, a lot of that, those reports came out of South America.
Gotcha. And is there a point in time? I mean, is there a critical point in pregnancy at which either before said week, 25 or whatever, that the risk to the developing child or the developing fetus is higher? Or, I mean, if you're bitten after week 30, you're probably fine after certain systems are developed. Does that make any sense?
Yeah.
Okay.
I mean, I think that it's a great question. I think the thing to keep in mind anytime we think about any exposure in pregnancy is really that the first 67 days are when the fetus is forming. So when all of those body parts and systems are forming. And so that's always a very critical time when we think about any exposure during pregnancy, not just as it relates to Zika. I think that we're just continuing to understand, really the concern is that there seems to be some affinity of the virus for the formation and maturity of the neural tube. And so it's not just then at the time the neural tube is forming, but we know that there's maturation that happens over the course of the entire pregnancy. So I wouldn't be inclined at this moment to say that it's not an issue at any kind of given time in pregnancy, though certainly we're always particularly concerned about that first trimester.
You say the first 67 days. You've got it down to that's amazing. I had never heard that number before, but that's a very definitive amount of time that all of those systems are developing.
We try and make life easy for ourselves and say first trimester, but things are pretty wrapped up by those last couple weeks of the first trimester.
Interesting. I have so many follow-up questions about that, but I will not get into them right now. As far as preventing Zika, I mean, obviously limiting travel to places where the virus is not, but what about, mosquito repellent? I mean, should we worry about chemicals in it, or are they safe for pregnant women?
Safe for pregnant women, as long as you don't eat it.
Okay. So, I breathed it in heavily not long ago, and I can tell you I don't think it would taste good. It was outside and it blew back in a fog. I was like, oh, that's just not pleasant.
So this is another one of those kind of is the case for bug repellent, and is the case for many things where it's always good to check with your provider to know whether or not things are safe during pregnancy. In fact, many more things are safe and reasonable to do than folks realize, which is one of the reasons why I think all of this is so fun. So bug repellent is actually a great thing to use. It's probably the best way to prevent yourself from being bitten by mosquitoes. We also say, when there's a choice, wear something longer sleeve, cover up a little bit more. One interesting thing about the bug repellent thing is that there are instructions on bug repellents, which I've never read in my life until I was doing all of this, and we were working on how to counsel patients about Zika. And most bug repellents will say that you need to refresh that application every sort of so often, and so you should actually use it and follow the instructions.
It's like sunscreen.
Yes.
It is amazing because I guess it makes sense. You're outside, it's hot, you sweat a lot of it off, you have to reapply occasionally, but it is amazing the number of things you mentioned that about the things that we're told to be scared of. I truly, and I'm still so proud of this, I had read somewhere and legitimately believed it was not safe for pregnant women to pump gas for a certain period of time. It was great because my husband believed me and did that for me until the doctor said, no, you're really okay.
Well, ladies, definitely maximize those to your advantage.
Yes. I was still trying to come up with a way not to have to take the garbage out ever. But what about young kids? So we talk a lot about pregnant women and adults, and is there a risk to young children who are in these environments where they could be exposed to Zika virus, or is that less of a concern once the brain is formed and the neural tube is in place and all of that?
It's a great question, and I think the verdict is not in.
We're still learning.
So we're still learning so much about the virus and how it behaves and how it impacts the developing brain. I think it's a perfectly reasonable question to ask whether or not it could have any effect on children or childhood development. I think that that's a much harder question to answer, though, because if you think of all of the things that are happening right now as your baby develops, and then you think about all the things once your baby's here that are going to impact the development of that baby. So I think studying brain development is something very challenging, but certainly we don't have evidence that of particular concern at the moment.
Okay, and finally, we're on this campus where there is so much research being done, and there are so many physicians who are in the labs day in and day out. Where does research stand now for this virus, and can we anticipate that there will be a lot of development surrounding whether it's a vaccine or something like that in the near future?
Yeah, I mean, I would absolutely anticipate that. First, some of the, even groundbreaking discoveries are happening right here on this campus. And one of our basic scientists in OBGYN, Dr. Mesercourt, is actually, she and her lab are working very hard on this now. So I think many scientists really around the world are doing work to help us understand, but of course we want to ultimately prevent it, and a vaccine is a perfect example of the types of things that can be developed. I think if we think back in time of sort of new discoveries and how long it took to discover things and then do all of the things that needed to happen to get to the place of a vaccine, those time frames are becoming so short now because science has made so much progress that we can really look forward to the identification of an illness and then fast forwarding to really excellent treatment in such a short period of time. So I'm extremely optimistic that we'll learn quite a bit more, which I think is always kind of soothing for everybody. It's always a little bit difficult as a physician to say we don't know answers to great questions like some of what we've had today. So I think I really have high expectations that we'll make a lot of progress both in our understanding, whether or not we think there's real risks for young children and others, and then what sorts of things we can do to prevent it.
It is so interesting, and it is so encouraging too, because I know with the scientists and the physicians that we work with here on campus, I mean, me saying I don't know is a daily part of my job, and it doesn't really bother me all that much anymore, but I can tell it really gets under the skin of anyone whose job it is to find an answer, and to not have that, you can really see it bothers a lot of these physicians. So I'm really glad there are people out there who are so intent on finding the answers that you have to believe that there is going to be a lot more information out there soon. And we even saw in the last couple of years, I think about the news cycles that we have seen with Ebola virus, with Zika, with all of these things, and a lot of it fades away thanks to what comes out of medical research. So it's nice to know that we have that to look forward to. And finally, my last question, and one thing I probably should have asked early on, we talk about the different ways this can impact a fetus. Would it be evident in the course of a woman's pregnancy with good prenatal care and screening? Would evidence of the virus present itself early in that development? Would you see that child was going to be born with issues?
Oh, I see what your question is. Yeah. So really, many of the findings that have been described in terms of impact of Zika that has been contributed to fetal development. Ultrasound is a great tool. It's not a perfect tool for everything, but it's actually a great tool for the examination of the neural tube. And so certainly, very severe cases or some of the other types of findings that have been associated with Zika are things that we would expect very often to be able to pick up on ultrasound.
So that's reassuring, at least to know. I think that a lot of people wouldn't at least go blindly into it. So thank you so much, Dr. Kayla. I think your takeaways from this are don't travel to affected areas, look them up with the CDC, and the bug spray is safe to use.
Yes, wear bug spray.
Wear bug spray, and you can pump gas. All right, thank you so much for joining us today. We appreciate it. We'll be back next Friday at 1 o'clock with From Belly to Baby.